1,000 new COVID infections are reported here in the U.S. every hour. 1,000, mostly among the unvaccinated. And as kids get ready to go back to school, there is renewed concern among doctors about what this means for these kids. So for tonight's big story, we want to look into the rise of COVID cases among Indiana children and the timeline to get a vaccine for kids under the age of 12. But first tonight, local doctors weigh in on what parents need to know before the school year begins.
Children are often seen as less vulnerable when it comes to getting COVID. But even today at Riley Children's Hospital, they're still seeing cases.
Several get admitted to the hospital, several get admitted to the intensive care unit. We're still seeing the multi-system inflammatory disease.
Rising cases from the Delta variant have not been any help, but what Dr. John Christensen at Riley is more concerned about is what will happen in the coming weeks and months as millions of students head back to school.
We know very well that especially the younger children have not been vaccinated yet, right? So they can still be transmission in that community.
Last year, schools went heavy on COVID restrictions, but in plans for this year, many districts are going a lot lighter. Most will not have a requirement for masks, even for students who aren't eligible for a vaccine. Of the plans released so far this year, 13 News has only confirmed 4 districts where masking will still be mandated for students under 12. But Dr. Christensen says the bigger risk may be everyone else in schools.
If there was one group of people that are going to be at the highest risk of coming down with coronavirus, is going to be those teachers and those staff members who work at the school who have decided not to get vaccinated.
Which is why he prefers that schools stay with what has worked.
We know that those strategies work. Until we can get everybody vaccinated, we need to continue those strategies.
Let me give you a closer look at COVID cases among Hoosier kids under the age of 19. Now you can see over the last few weeks, right toward the end of June into July, you can see the numbers begin to trend up. Now this mirrors what we're seeing with adults as well. Now we don't know how many of these cases are the Delta variant, but that's about the time we've really started hearing from health officials about the numbers taking off. Now let's go ahead and look back a little bit more in time here. So this is back in April and in May, back in springtime. So where we are right now, you can see we're well below the numbers that we faced back here in the spring, but it is clear the numbers among kids are on the rise. We're close to about 100 kids diagnosed with COVID every day. Now, if you're wondering about vaccines among young Hoosiers, only 26% of eligible kids are fully vaccinated, and that's ages 12 to 19.
We know many families now are preparing for last-minute vacations because they want to get it in before the upcoming school year. Here's what top pediatricians want you to know about the Delta variant and your children. They say while this variant is more contagious, it doesn't appear to be more dangerous to kids than the other COVID-19 variants. The CDC and the American Academy of Pediatrics both agree that classrooms should be in person this school year. Doctors say students that have underlying medical condition or those living in states that have low vaccination rates should wear masks in school. Now the good news here, health experts say keep your travel plans. Children flying while masked don't seem to be a major source of transmission. They also say play dates, put them back on the calendar. But parents, make sure you do ask about the vaccination status of people who are living in the home and if anyone has any COVID-19 symptoms. Pediatricians say the best thing you can do to help your kids is to make sure you go get the shot yourself.
Now, when it comes to a vaccine for kids under the age of 12, the FDA expects emergency use authorization between early to midwinter and then hopes to move on to full vaccine approval for that age group. Now, both Pfizer and Moderna launched vaccine trials for kids under the age of 12 back in March. Results are expected in the fall when the FDA starts its review. And that wraps up tonight's big story.